Hey, Dr. Ron here with a short but important message. You are not your medical condition. Most of us who are adults have managed to pick up a few injuries or significant medical issues as we've aged. I know in my case, I've had a hip replaced, I've had cataract surgery, some root canals, and I'm currently struggling with a rotator cuff tear. I've gotten to the point where I can comb my hair and reach up and certain conditions, really trying to avoid surgery. But not that many people know about it because it's not a major point of discussion for me. It's not something I avoid, but I want people to know me totally, that I am a husband, father, doting grandfather, psychologist, lots of different things. I have particular interests in music and sports, and again, that's all part of my definition. But let's not talk about me. Let's talk about you, especially those of you who have some difficulties in dealing with chronic pain or other kinds of medical conditions. One of the first things that I want you to acknowledge is that pain sucks. Medical problems suck, but they shouldn't be your entire life. When you allow them to, then it impacts upon your level of activity, your level of enjoyment of life, and ultimately may impact upon who winds up being friends with you, because as I've written about in my book, Rejuvenaging, that my unscientific study has demonstrated that if you get about 5 or 6 people in a room, at least past middle age or in middle age and beyond, at least one of them will divert the discussion into a medical report. Very few people have the same vested interest in your medical condition as you do, and in some cases, your own vested interest is probably too much. The first thing is, if you have something wrong, make sure that it's addressed by a physician, follow those directions, but also keep in mind, what else are you and what can you do to function within the limitations that your condition imposes. Do not define yourself by your medical condition unless it is so severe that you are disabled and can't function at all. And even then, you may be able to find some things that you can do to help you both feel productive, feel positive, and feel accomplished. Everybody is a combination of different things. Career, family, interests, and medical issues are all part of that combination. When one of them supersedes everything else, then it upsets life's balance. If you're a workaholic, you're denying yourself certain other pleasures of life. If you're overly focused upon medical issues, same thing holds true. Make sure that you get the best treatment that you can. Make sure that you also consider what else you can do to coordinate with those conditions that you may be having to make life as fulfilling as possible and to enable you to grow through the aging process when you get there in the most positive way, without defaulting to your medical definition, to your medical condition as a definition of yourself.